Roberta Colucci conducted a study with her colleagues where they gathered 130 patients who were diagnosed with vitiligo and examined them from October 2012 to July 2013. Roberta Colucci explains in the 2014 issue of Dermatological Therapy that she divided the 130 patients into two groups. Group A was given an oral antioxidant, while Group B was not. Group A took this oral antioxidant 3 times a day for 6 months. I felt that this study was very interesting to me because I myself have vitiligo. I was diagnosed very young and given a topical cream by my dermatologist and applied it 3 times a day as well. It brought repigmentation back to my skin, but I still have many spots all over my body. But you're probably wondering, okay, what does this do for me? Well, we live in a very diverse world. And we see people every day, and don't you ever wonder why people look the way they do? Well, the next time you see someone with vitiligo, you'll know why they have it. So today I'm going to inform you about vitiligo and some important information you should know about this skin disease. First, what it is. Second, why people get it. And third, if it's treatable. First, what it is. Vitiligo is a depigmentation that causes white patches on the skin. K.M. Algandi stated, "The loss of skin pigmentation resulting from disappearance of pigment cells because of the application of chemicals or because of an autoimmune disease and genetic factors such as vitiligo is called depigmentation." Most people don't know this, but vitiligo also affects your psychosocial functions. It causes depression, anxiety, and suicidal thoughts. This happens because people are embarrassed by the way that they look and they avoid social situations. Now you're probably wondering, why do people get vitiligo? Well, the answer to that is unknown, because researchers and doctors do not know, but there are definitely assumptions. The Philadelphia Tribune, dated August 7, 2011, explains vitiligo may be an autoimmune disease. This happens when the immune system mistakenly attacks its own body. In vitiligo's case, the immune system may destroy the melanocytes in the skin. Other doctors think sunburn or distress may cause vitiligo, but that is not proven. Also, anyone can be affected by vitiligo because studies are unsure why it's caused, so they don't know why people get it. Let's take a look at if it's treatable or not. Vitiligo can be treated, but not fully, unless you get intensive surgery. Also, many treatments subside vitiligo, but don't fully bring pigmentation back. Henry Lim writes in the 2012 issues of India Journal of Dermatology, "There are now multiple treatments for vitiligo, ranging from topical steroids, topical inhibitors, UV light therapy, surgical treatments such as skin grafting, and transplants." As I said before, no one is completely sure, so there is no proper cure. I'm going to show you a few pictures of the progress of the Roberta Colucci study, that after taking the oral antioxidant for 6 months, you can see that the vitiligo has subsided but has not fully gone away, which proves my point that nobody knows a direct cure except for intensive surgeries. So to conclude, I explained what vitiligo is, why people get it, and if it can be treated. So you're probably wondering what happened to those 130 patients Roberta Colucci conducted, the study that Roberta Colucci conducted. Well, according to Roberta Colucci, Group A showed mild repigmentation in the head, neck region, and trunk. On the contrary, the number of patients without repigmentation in the head, neck, trunk, and upper lower limbs was higher in Group B. So this study showed that there is ways to subside the vitiligo, but it cannot fully be repaired without intensive surgery. So now that I explained what vitiligo is, why people get it, and what treatments there are, then I hope you have more knowledge on vitiligo. Thank you. My name is Arianna Aulisi.